just want to take a second to thank the moderators and the organizers for the opportunity to present our work today, looking at the use of these soluble guanylyl cyclase activators as a novel therapeutic for peripheral arterial disease. So peripheral arterial disease refers to reduced perfusion of the lower vasculatures, usually as a result of the accumulation of atherosclerotic plaque within the aortoiliac, femoral, and tibial vascular beds. It affects 6.5 million Americans in the United States over the age of 40, and usually presents either as claudication, in which patients complain of reproducible pain in the lower extremities with activity, or more severe manifestation, which is critical limb-threatening ischemia, or CLTI. These patients present with pain at rest or with tissue loss as non-healing ulcers. And we can improve blood flow either with angioplasty, stenting, bypass surgery, but at the end of the day, those patients with CLTI, after the diagnosis of CLTI, 50% of patients undergo or at risk for a limb loss or death at 1 year. So our medical management of PAD usually involves targeting clinical risk factors. These are things like hypertension, hyperlipidemia, smoking cessation, and that's thought to improve endothelial function, for example, and reduce the risk of accumulation of atherosclerotic plaque. But the genetic risk of PAD has recently been looked at using large genome-wide association studies. And what's not surprising is that the genetic predisposition to certain conditions like hyperlipidemia, diabetes, and smoking is associated with peripheral arterial disease. But what's new is that the genetic predisposition to conditions or to genetic predisposition to inflammation or thrombosis also associates with peripheral arterial disease. And so I want to highlight this association with thrombosis because it actually supports clinical evidence that the use of antithrombotics in PAD reduces the risk of amputation and limb loss in patients with PAD. So what you can imagine is as we start to increase the number of associations that we have with PAD, we can start to develop novel therapeutic targets. And that's exactly what we're doing. We're leading the largest PAD genome-wide association study using data from the Million Veteran Program, UK Biobank, Copenhagen Biobank. And I won't go through all those novel associations, but I do want to highlight one that we found in the NOS3 locus. So this is a plot depicting genetic variants. Each dot is a genetic variant, and the height of the variant is the association with PAD. So what you find is a variant associated with PAD that lies in the intron of NOS3. And this variant also lies in a area of chromatin that's accessible only in endothelial cells. In other words, it's a cis regulatory element that's endothelial cell specific. We know this from publicly available single cell attack sequencing data. And we also know that the risk allele, the T allele, is associated with reduced expression of NOS3 in aortic tissue and tibial tissue. So what is NOS3? It's actually a gene that encodes endothelial nitric oxide synthase and is critical for endothelial cell function. It catalyzes the conversion of oxygen and arginine to produce nitric oxide. Nitric oxide then diffuses across the cell membrane to smooth muscle cells, where it binds to soluble guanylate cyclase and activates a series of events that leads to vasodilation. In endothelial cell dysfunction, impairment of endothelial nitric oxide synthase reduces bioavailability of nitric oxide and inhibits the ability of the smooth muscle to vasodilate. So clearly it's critical for vascular homeostasis. So we can start to look at how this variant might function by looking at its association with other cardiovascular traits. And we can see that this variant is also associated with systolic and diastolic blood pressure and has associations with LV stroke volume and diastolic volume and coronary heart disease. So you might ask, is the association just driven by its effect on blood pressure rather than a direct association? We can use Mendelian randomization to address this. And actually, what we can find is that the effect of the risk allele on coronary heart disease is greater than what you would expect if it acted on through systolic blood pressure alone. And we can run a similar analysis for peripheral arterial disease where we have a similar result. So these data together suggest that this risk variant is associated with PAD, and it supports the hypothesis, but that potentially it directly drives development of PAD. And regardless of genotype, we actually know that endothelial cell dysfunction is prevalent in PAD. Patients with PAD have reduced brachial artery flow-mediated dilation and reduced serum nitric oxide levels at baseline and after exercise. And what's really exciting is now we can actually target nitric oxide signaling with soluble guanylate cyclase activators. There are a couple of drugs, Vericiguat and Riociguat, that have been approved by the FDA for use in heart failure and pulmonary arterial hypertension, respectively. And we think the more interesting of these drugs is actually Riociguat, as it has a dual mechanism of action. It can activate soluble guanylate cyclase in the presence of endogenous nitric oxide by making the binding of nitric oxide to soluble guanylate cyclase stronger, or stabilizing it. And it can also act independently of nitric oxide by directly activating soluble guanylate cyclase. So we wanted to test the hypothesis that Riociguat would be able to improve perfusion in an animal model of PAD. So we used eNOS heterozygous mice that lack a single allele of eNOS to model patients who harbor a risk allele, and pre-treated with Riociguat and induced a PAD model with hind limb ischemia. We then looked at perfusion using laser Doppler imaging and exercise capacity with treadmill testing. And what we find is that Riociguat actually improves functional capacity in eNOS heterozygous mice. We can see that by looking at exercise capacity and the distance traveled by these eNOS heterozygous mice treated with drug. However, we don't see a difference in perfusion. When we look at clinical scores, we can see that there's a trend towards a benefit for Riociguat treated animals in terms of his Tarlov score. And we can also see reduced risk of tissue loss in the modified ischemia score. So in summary, we basically find that we've had this new novel association with NOS3 for PAD. We can see that PAD, in a mouse model of PAD, treatment of eNOS heterozygous animals with Riociguat improves exercise capacity. And in the future, we're moving forward to a trial looking at soluble guanylate cyclase activators in PAD patients. And so we've partnered with Merck to run a double-blind randomized controlled trial here at Stanford with 50 patients, and they'll provide the drug and look at these patients over 26 weeks. These patients can sometimes exhibit hypotension with increasing doses of Riociguat. And so we're planning to incrementally increase dose over time, as has been done in other clinical trials, and also observe these patients in clinic at the start of the study to make sure that their blood pressure doesn't change dramatically. We're going to include patients who are diagnosed with advanced PAD but do not have CLTI, and we'll also exclude patients with advanced cardiopulmonary disease. As our primary endpoint, we'll be looking at the mean difference in 6-minute walk tests at 26 weeks, and then also as a secondary endpoint, look at changes in ABI and changes in flow-mediated vasodilation, in addition to quality of life survey. So I'd like to thank Dr. Claren and Dr. Leeper for their mentorship, and Sabina Sarando for her contribution to this project. So thanks. I'll take any questions.